my name's Steph, or Dr Stephanie Slater. I am a GP trainee currently working in London, and I'm here today to chat a little bit about mental health. I myself have anxiety and depression, and I've had some really tough times, but I've learned loads. I've got so many good coping mechanisms now, and I'm really trying to reduce the stigma around mental health. I hope you enjoy this. Okay, on to the next one. Will a GP... Dun, dun, dun. Okay. Oh no, I really shouldn't have cut my nails short. Will a GP give me antidepressants? So, yes. So, a GP definitely can give you antidepressants. I think the thing to say is that it's such an interesting thing, and I'm really keen on getting rid of the stigma around antidepressants. I myself have taken an antidepressant before, and I found it really useful. I'd also done talking therapies alongside that, and I think they give you so much knowledge about why you think a certain way, how you can maybe reframe your thoughts. And that talking therapy, I think, is something that I will take with me through the rest of my life. I might need it again. You know, it's not always going to be smooth sailing, but I think they give you so much, so many coping tools. Antidepressants, on the other hand, I think can be really useful in certain moments, and it's something that if you're keen to talk more about them or learn more about them, it's a great thing to mention that to your GP. They can be useful more in the short term, so we tend to say to patients, we'd like you to be on them for around 6 months, and then if it's the case that in a year or so, or a couple of years you're still on them, we can think about weaning them down. Everyone's different, and it's all an individual process, but yes, we definitely can give antidepressants, and we'd be more than happy to speak to you and talk you through what we think might be best, and come hopefully to a shared agreement on things. Will a GP give me a sick note? So yes, we definitely can give sick notes. So I think sick notes are something that, unfortunately, there's a bit of a stigma around them as well. I think it's, again, a really individual thing. So when we speak to a patient, hopefully we'll be able to get lots of information, talk to each other, build up a professional relationship and get that rapport and work out what's best. One thing I would say with sick notes is that we do tend to find that work can be really useful for people. Yes, definitely not in that moment when you're really, really struggling and things are really difficult for you with your mental health, but having some routine can be really good, and having that distraction as well. And I've really found that personally. There were times when I've been off work and my GP very kindly gave me a sick note, and I really needed it just to recuperate and get myself back. But then once I started having routine again, I found that was really useful for my mental health. Will a GP tell my parents I self-harm? So thank you for asking this, and I'm sorry if someone's going through this at the moment that they're asking this question. I think it can be a bit of a tricky one, but what I would say is that our main goal is to make sure that you feel safe and you feel supported. Things like self-harm and age ranges. So I would say that if someone is self-harming and they're quite young, what we tend to do is have that conversation with the patient and just say, could we talk to your parents about this? Could we involve them? And that's really just to try and help them feel more safe and help them be supported. It's not a definite thing here and there unless we're really worried about your safety, and we will always try and respect what you want. But I think if it's at a point where you're feeling low and you're wanting to harm yourself, our goal is really try to keep you safe and try to help you to feel better, and we do that in lots of different ways. So it's a difficult one to answer. It depends on your age a little bit, but I would hope you know that it's not our goal. If someone tells us something, it's not the first thing we say, oh, we have to tell your parents. It's more, how can we support you and how can we move forward and how can we make things better? Thank you so much to Best For You for inviting me to here today to speak about mental health. I've had such a good time and I've loved answering all your questions. I really hope for anyone who is struggling that you know that you're worthy and deserving of support, and I really hope that you feel you can speak to someone if you've not done that yet. Either way, we're here for you, and I really hope that you can check out some of the Best For You information for more support. And I'm on Instagram as @Dr Stephanie Slater in case you'd find that useful to have a look at my page. I hope you have a great day, and thank you so much for listening. Bye.